Welcome to the Deep Dive. We take your sources, dive deep, and pull out the most important insights.
That's right.
Today, we're tackling a stack of your revision notes, specifically focused on the management of animal and human bites. Our mission is to distill this information into a really clear, high-yield understanding.
Exactly. Think of us as your guides through this material. We're here to help you extract those crucial nuggets, connect the dots, and make a potentially complex area manageable and memorable for revision or just getting truly well-informed.
Okay, let's unpack this then. We're going to cover the whole picture. What a bite is, how it happens, what risks are involved, how you tell it apart from other injuries, how common it is, what you see, how to investigate, the absolutely critical steps in managing it, what the outcome looks like, and the potential complications. Let's dive in. So first up, what exactly are we talking about when we say animal or human bite? The notes define it pretty simply: an injury caused by teeth breaking the skin.
Right. And the immediate key takeaway is that the severity, it varies dramatically. You can have a minor scrape or really serious tissue damage. And critically, they all carry the risk of infection and significant complications.
One thing that immediately stands out from the notes is the difference in the bugs involved. Animal bites, often from dogs and cats, frequently involve an organism called Pasteurella multocida.
Yeah, that's a big one. But what's really fascinating here is the contrast with human bites. They're typically what the notes call multimicrobial.
Multimicrobial.
Yeah, instead of one main culprit like Pasteurella, you're dealing with a whole mix of bacteria from the human mouth. Things like Streptococcus, Staphylococcus aureus, Eikenella, Fusobacterium, Pathophysology, you name it. This difference in the sort of microbial soup is why human bites can be much trickier to treat when they get infected.
Got it. So same basic mechanism, teeth breaking skin, but already we see a critical difference in the microscopic world that gets introduced into the wound. So how do people, how do they actually end up getting bitten? The notes list the causes, or what's medically known as the etiology.
For animal bites, it's often straightforward. Interaction with animals could be your pet at home, working with livestock, or encounters with wildlife, depending on where you are.
And human bites, that feels like a very different scenario.
It often is, yeah. While they can happen accidentally, say trying to catch a fall or something, the notes point out they often occur during intentional acts like altercations or aggression. Sometimes it's in self-defense too.
That makes sense.
Yeah.
And are certain people more likely to get bitten? What are the risk factors we need to think about?
Well, for both animal and human bites, the main risk factor is simply being in situations that involve potential conflict or close interaction with animals or people.
Right.
Like we just mentioned, that includes things like owning pets, certain jobs, or unfortunately being involved in fights or domestic violence situations. Pretty logical when you think about it.
Okay, that clarifies the risks. Now, how does a bite actually do damage to the body?
Yeah.
The notes cover the pathophysiology, essentially, the mechanics of the injury.
Right. It's not just the initial break in the skin. Bites cause direct physical damage. They can be cuts or punctures or even crushing injuries depending on the animal or the force involved.
And that physical damage creates an entry point for something else, doesn't it?
Exactly. The critical next step is bacterial contamination. The mouth is full of bacteria, right? And the bite pushes these pathogens deep into the tissue.
Okay.
The severity and potential complications depend heavily on factors like how hard the bite was, where on the body it happened. Like a bite on the hand is usually higher risk than one on the arm, for example.
Why is that?
Just the complex anatomy, poor blood supply in certain areas. Also depends on how deep it went and whether it damaged important underlying structures like nerves, tendons, or even bone.
Fascinating. So knowing how the injury happens is one piece. But clinically, when someone presents with a wound, how do you actually tell if it's a bite and not just some other cut or puncture? This is where the differential diagnosis comes in. What else could it be?
This raises an important point. You absolutely need to consider other types of skin injuries. First, simple cuts, abrasions, other puncture wounds from things like nails or sharp objects. It's not always obvious.
And it's not just about the physical wound itself, is it?
Precisely. You also need to be aware that sometimes infections or underlying medical conditions can mimic the look or symptoms of an infected bite, even if no bite occurred.
The notes add some really crucial additional considerations here. Like if you see an adult human bite on a child, that should immediately raise concerns about non-accidental injury.
Absolutely. A major red flag.
Similarly, animal bites on children could point to issues with supervision or parenting.
This is where the context is absolutely vital. The notes emphasize that if the story isn't clear, you might need to really think hard about whether it was a human bite, an animal bite, maybe even a large insect bite, or if it's something else entirely, like an infection that just started spontaneously and looks like a bite wound. It's not always clear-cut.
Okay, let's think about this for a second. Imagine someone has a red, swollen, painful wound on their forearm, but they're a bit vague about what happened. Based on what you just said, what are a couple of things you definitely need to consider besides a simple cut or abrasion?
Well, you'd obviously consider it being some kind of puncture wound, maybe a bite they're reluctant to mention. But you'd also be thinking about those non-traumatic infections that can look similar, like cellulitis starting.
Right.
And depending on their general health or if the pain seems really out of proportion, you'd be considering if it could be something more serious starting, like a deeper infection. Which brings us back to potential bite complications we'll discuss later. You have to keep an open mind.
Let's talk numbers now. How common are these bites, particularly in a place like the UK? This is the epidemiology section.
This part has some pretty striking facts, actually. Dog bites are surprisingly common in the UK, leading to around 7,000 hospital admissions every single year.
Wow, 7,000 hospitalizations just from dog bites. That's a significant number.
It really is.
And the notes break down the frequency. Dog bites are the most common, making up 60–90% of reported bites. Cat bites are next at 5–20%, and then human bites are 4–23%. So dogs are definitely the leaders here.
And here's where it gets really interesting regarding dog bites. Children are commonly bitten, especially young ones under the age of 5. That's a key demographic.
The notes even list specific breeds mentioned as being more likely to bite. German Shepherds, Pit Bull Terriers, Chows, and Rottweilers are listed there.
Yeah, although breed is always a complex issue. Looking globally, the estimates vary, partly because, a lot of bites likely go unreported.
Makes sense.
But figures around 175 to 740 dog bites per 100,000 people annually are cited for Europe and the USA, so it's common worldwide.
What about human bites? Where do they typically happen?
Most human bites, as we touched on, occur during fights. But they can also happen in sports or during sexual activity. The notes specifically highlight something called clenched fist injuries.
Oh, right. You mentioned those.
Yeah, they're particularly high risk for infection. That's when someone punches another person in the mouth and their knuckles or hand get cut by teeth. Because of the potential for deep penetration right into the joints or tendons of the hand and the bacterial load of the mouth, those are really prone to nasty complications. A really high yield point to remember.
Okay, so if you're trying to remember the relative frequency, maybe think DCH, dog first, then cat, then human. Dogs are top of the list.
Good mnemonic, DCH.
All right, someone presents with a bite. What does it typically look like, and what absolutely has to be done when you're assessing it?
Clinically, well, you'll see the basic signs of injury. Pain, some bleeding maybe, swelling, redness, and the visible break in the skin, the wound itself.
And the severity and location will determine if you see more concerning signs, like signs of infection already setting in, maybe difficulty moving the affected part, loss of function, or even clues that nerves, tendons, or bones might be damaged underneath.
The assessment section is incredibly practical. The notes say, for all bites, you must thoroughly document the details, figure out exactly how, when, and where it happened, and describe what the injury looks like. Get the story.
And this is key. You have to actively assess for damage to those underlying structures we just mentioned: tendons, arteries, nerves, joints, and bones.
Yeah.
You need to specifically check.
Definitely. You also need to identify if the patient themselves has risk factors for infection, things like having diabetes, being immunosuppressed for any reason, or even just the location of the bite.
Like the hands and feet.
Exactly. Hands and feet are much higher risk sites due to the complex anatomy and, relatively speaking, lower blood flow compared to, say, a bite on the thigh. You're also looking for existing signs of infection: increasing redness spreading out, more swelling, any pus or discharge, worsening pain, or a fever.
Checking their tetanus status is crucial, isn't it?
Absolutely vital. And always ask about medication allergies, especially penicillin allergy, before you even think about antibiotics. The notes recommend considering an X-ray in specific situations. Definitely for those clenched fist injuries we talked about, any crush injuries if you clinically suspect a fracture, or if you think there might be a foreign body stuck in the wound, like a tooth fragment.
Okay.
For penetrating bites to the scalp, an X-ray should also be considered to check the skull underneath.
Now, for human bites specifically, there's a really important risk to assess, right? Bloodborne viruses.
Absolutely critical.
Yeah.
You need to consider the risk of hepatitis B, hepatitis C, and HIV transmission. This involves trying to gather information about the person who did the biting. If possible, are they known to have any of these infections? Do they have risk factors like IV drug use?
And the bitten person's status.
Yes, and you need to know the bitten person's own status. Are they already infected? Are they vaccinated against Hep B? The circumstances of the bite are also key clues. Was alcohol involved? Was it related to domestic violence? Is there suspicion of non-accidental injury? All of that factors into the risk assessment and potential follow-up.
And for dog and cat bites, the specific risk you always think about is rabies.
Yes, but importantly, the notes clarify there is essentially no risk of rabies from dog or cat bites acquired in the UK. This assessment is specifically for bites sustained while traveling outside the UK, especially in areas where rabies is common.
So you need to ask where it happened.
Exactly. Where did the bite happen? Was it a domestic or wild animal abroad? Does anyone know the animal's vaccination status? Crucial questions for travel-related bites.
So what tests or investigations might be needed then?
Well, the investigations are directly linked back to your assessment findings. First, you'll do that thorough wound assessment we just talked about. Visual inspection, palpation.
Then comes imaging x-rays or potentially ultrasound. As we covered, this is primarily to look for those specific issues. Fractures or foreign bodies like a broken tooth piece.
Right. Laboratory tests might be necessary if you suspect systemic involvement or a widespread infection, things like blood counts or inflammatory markers. Though the notes don't list specific mandatory labs here, it depends on the clinical picture.
And a critical investigation if infection is suspected or already present. Culture samples.
Definitely. Taking a sample from the wound, ideally before antibiotics if possible, allows the lab to identify exactly which bacteria are causing the infection. This is essential information because it guides which antibiotic will work best if treatment is needed, tailors the therapy.
So, a simple way to remember the key investigations. Maybe think WILC wound assessment, imaging, X-ray ultrasound, labs if needed, and culture if infection is suspected. WILC.
WILC. I like it. Covers the bases.
All right, let's get to the core practical section, management. How do we actually treat these bites? This is what everyone needs to know.
The management principles are outlined very clearly in the notes. First and foremost, clean, irrigate, and debride the wound. Cleaning is king.
Okay, clean, irrigate, debride.
Then decide if antibiotics are needed and prescribe the right ones, tailored to the risk or established infection. Administer tetanus prophylaxis if required. And for more complex or severe injuries, surgical intervention might be necessary, maybe exploration or washout in theater.
Diving into those principles, irrigation. How important is that?
Thoroughly irrigating the wound is paramount. That means flushing it out generously with warm water or sterile saline. This is a simple but incredibly effective step because it mechanically washes away bacteria and contaminants. Don't underestimate simple washing.
And never forget, tetanus immunization. Always check if it's up to date and give a booster or immunoglobulin if needed based on the wound type and history.
Absolutely. And here's a really practical high-yield point from the notes. Avoid primary closure. That means stitching the wound closed immediately for deep puncture wounds, especially if they're not on the face.
Why is that so important again?
Because these deep bites can push bacteria deep into the tissue. If you stitch it closed, you're essentially sealing those bacteria inside a perfect warm anaerobic environment for them to multiply, significantly increasing the risk of a severe infection or abscess.
Oh, okay. Trapping the bugs.
Exactly. Letting the wound heal open from the bottom up, perhaps with delayed closure later, is often safer for those types of bite wounds.
Okay, so not all bites get antibiotics up front, right? The notes say only certain ones get prophylaxis.
Precisely. The notes list the situations where prophylactic antibiotics, meaning antibiotics given to prevent infection, are recommended. All cat bites.
All cat bites. Why?
Cats have sharp, needle-like teeth that cause deep puncture wounds, inoculating bacteria deeply. Plus, Pasteurella is very common in cat mouths and causes rapid infection. So all cat bites get prophylaxis. Also, recent human bites, typically those seen within 72 hours, and any high-risk wounds or high-risk patients.
What constitutes a high-risk wound or patient again?
High-risk wounds include things like bites on the hands or feet, bites near joints, or prosthetic implants. High-risk patients are those with underlying conditions that compromise their immune system or healing, like diabetes, liver cirrhosis, or being immunosuppressed for other reasons like chemotherapy or long-term steroids.
Got it. And which antibiotic is the first choice for prophylaxis?
The go-to first-line antibiotic listed for domestic animal bites, dog or cat, and human bites needing prophylaxis is coamoxiclav. Covers the likely pathogens well.
What if someone is allergic to penicillin, like coamoxiclav?
Good question. The notes list alternatives for penicillin allergy. Doxycycline plus metronidazole is a common one. Others mentioned are oxytetracycline plus metronidazole, or sometimes clindamycin plus ciprofloxacin. You need that anaerobic cover, off from the metronidazole.
And how long is the course?
The standard course for prophylaxis is typically 5 days, according to these notes.
Okay. What if the infection is already established when you see the patient? They come in late, it's red, hot, maybe draining pus.
Right. Treatment for established infection builds on the prophylaxis principles, but it's treatment, not prevention. Remember, human bites are polymicrobial. Most bite infections are too, although Pasteurella, multocida, Staphylococcus, and Streptococcus species are the most common players.
So same antibiotic.
Coamoxiclav is still usually first line for mild to moderate established infections. For penicillin allergies, it's back to doxycycline plus metronidazole usually. Oral antibiotics are often sufficient unless the infection is severe or systemic, in which case IV antibiotics and maybe surgical drainage might be needed, and the course would typically be longer than 5 days.
And we talked about the blood-borne virus risk with human bites, Hep B, C, HIV. How is that managed practically?
The notes state the risk of transmission through bites is generally low, which is reassuring, but it's crucial to follow your local guidelines for post-exposure prophylaxis, PEP.
So it depends on local policy.
Yes, exactly. But it could involve considering hepatitis B immunoglobulin and vaccine for Hep B exposure if the bitten person isn't immune, and potentially discussing or offering antiretroviral drugs for HIV exposure, guided by a careful risk assessment and local protocols. Specialist advice is often needed here.
Okay, so a quick memory tip for the first-line antibiotic and when to give prophylaxis. First line is coamoxiclav, prophylaxis for CHH, cat bites, all of them, recent human bites, and high-risk wounds or patients.
CHH, nice and simple. Let's test that. A healthy young person gets bitten on the arm by their own dog. Do they definitely need prophylactic antibiotics based on the notes?
Okay. Dog bite, not cat. On the arm, so not typically a high-risk site like hand or foot. And a healthy person, so not a high-risk patient. Based on the CHH criteria from the notes, that scenario wouldn't automatically require prophylaxis, right?
Correct.
You'd still clean and assess thoroughly, give tetanus advice, and tell them to watch for infection, but you wouldn't routinely prescribe antibiotics just in case unless something else made it high risk.
Exactly right. That combination typically falls outside the prophylaxis criteria outlined here. Good application.
What's the likely outcome or prognosis after a bite? What can people expect?
Well, the prognosis, the expected outcome, it really depends on several factors. How severe the bite was initially, where it was located, how quickly the person sought medical attention, their underlying health status, and their individual risk of developing an infection.
But the good news is that most bites, with appropriate cleaning and management, do heal well, don't they?
They do, thankfully. The majority resolve without major issues. However, more severe bites, or those that unfortunately do develop infections, can certainly lead to complications and take significantly longer to heal.
Which brings us nicely to those potential complications. What can go wrong?
Infection is definitely the most common complication. It's the big one to watch for, particularly in those high-risk bites we keep mentioning, like bites on the hand or human bites.
And beyond infection, there's the immediate physical damage itself.
Yes, absolutely. Damage to nerves or blood vessels can happen, which might result in long-term issues like scarring, reduced function in a limb, or loss of sensation. And importantly, the notes explicitly mention the psychological trauma associated with these injuries. Being bitten can be terrifying.
That's a really important point, the psychological side.
Definitely. The risk of zoonotic diseases that can jump from animals to humans is another potential complication with some animal bites. Although, again, specifics like rabies risk depend heavily on the animal, the location, and vaccination status.
And the long-term effects can be significant, can't they?
They can. The notes highlight psychological impacts like ongoing anxiety, nightmares, or even PTSD, especially after a severe attack. Permanent scarring isn't just cosmetic. It can lead to depression and low self-esteem. These aren't trivial consequences.
The notes also list some less common but very serious complications. Tetanus, if not immunized.
A killer, but preventable.
Rabies, again, if bitten outside the UK by a susceptible animal.
Almost always fatal once symptoms start.
Septicemia or blood poisoning. Septic arthritis, infections spreading into a joint. osteomyelitis, infection getting into the bone, and even necrotizing fasciitis, that flesh-eating bug thing.
Yes, those are rare but devastating complications. It's a reminder that even a seemingly straightforward bite needs careful assessment and management because the potential spectrum of outcomes is really wide, ranging from a simple healed wound to quite severe long-term problems or even life-threatening illness.
Finally, the notes briefly touch on prevention, specifically focusing on animal bites.
Yes, they mention relevant legislation like the Dangerous Dogs Act 1991 in the UK, which allows for prosecution related to certain breeds and aggressive incidents. An amendment in 1997 is noted for adding some court discretion, apparently.
And they also mention that people can make civil claims for damages against owners under the Animal Act 1991 if they're injured by someone else's animal.
Yeah, these legal points just underscore that animal bites aren't only a clinical issue for doctors and nurses. They have significant societal and public health dimensions, too, with laws in place trying to improve public safety and accountability. So we've covered a tremendous amount of detail in this deep dive, haven't we? Working through the definition and causes all the way through the practicalities of assessment, investigation, and management, and finally touching on outcomes and complications.
We really have. We've pulled out the key differences between animal and human bites, especially those bugs, highlighted those crucial risk factors for infection, the CHH for prophylaxis, and walked through the essential steps in treating these injuries, including when and why antibiotics are needed and which ones are preferred.
This deep dive has hopefully given you, the listener, a structured, high-yield way to understand animal and human bites based on these revision notes, focusing on the information that's most critical for both understanding the why and the practical how-to.
So what does this all mean? Perhaps the thought to leave you with is how something is seemingly common and maybe straightforward as a bite, whether from an animal or another person, can actually open the door to such a complex array of potential problems. From that messy mix of bacteria causing tricky infections, to serious physical damage affecting function, and even lasting psychological scars. It's a powerful reminder, I think, that no injury should be casually dismissed. Always needs proper attention.
Exactly. Well said. Thanks for joining us for this deep dive.
And if you're using this for revision and want to consolidate your knowledge further, you can find helpful resources over at MSRA.com.
And there are also great materials available at freemsra.com.
We'll be back soon with another deep dive into your sources.